Dr. Patel, you said that you can put people to sleep with a thing called sedation dentistry. And there are many reasons why a patient might want to do that. So tell us a little bit how sedation dentistry works, for who it is made for, and tell us if it has any type of negative effects or something, like that. So tell us all about sedation dentistry and its advantages and for whom it is.
Sedation dentistry is really for very nervous patients. A lot of patients here in California never go to the dentist because they're very, very scared. There are several levels of sedation dentistry that one offers. One is just medications that are provided for the patient with a prescription that they take at home. Then they come in. Then there is prescriptions that we will administer here in the office via the mouth, where it's just a tablet, it's crushed, it's put in under the tongue. And the third form is to give an IV, where when you go for a colonoscopy, you get the same kind of medication. It's very safe, it's very controlled. We are always communicating with the patient. All the monitors are on, just like in a hospital. So the biggest advantage is, if you're very scared of the dentist, don't be, because you will not know that we worked on you. You will go home and you will be cured of your dental disease. All the things that you need can be done in one session. Therefore, you don't have to be continuously medicated. So it's a very, very advantageous situation for patients that are very scared to do their work.
So when a patient is under this oral sedation, under this sedation, whichever way he is under, but he still can talk to you. He can still be responsive to you. Yes or no?
Sedation dentistry is defined as a state of unconsciousness where we are able to communicate with the patient. So if I put my hand on your shoulder and say, Helmut, breathe, you will open your eyes slightly and start breathing for me. We never have the patient totally unconscious. So you're right. We are always able to communicate with the patient. Mm-hmm. The patient is not totally unconscious. However, the patient never knows or remembers what is being done to them afterwards. Mm-hmm. So okay. It's a very pleasant experience. They come in, they have their work done, and they're fine with that,
Well, I have heard a story that I think it was in Washington, that a patient did all his work and tremendous amount of work. Then he walked up to the front office, to the receptionist office, and the girl said to him, well, wonderful, your work is done. He says, what work is done? I haven't had any work done. When are we going to start? You're already asking me for money. What's wrong with you? Because obviously he didn't want to pay because no work was done. Did you ever having that problem? Are you...
Well, most of the time, my patients are usually put in a wheelchair and taken to their car, and they really don't remember anything when they come in for their post-operative examinations and consultations. So we don't have those kind of incidents because we make sure that we take.
I was just trying to be funny.
Yes, yes. But you're right. I mean, it's a very, very pleasant way to do dentistry for patients that are very scared.
Well,
if they're very scared and they don't go in at all, it is much better way and a humane way to do it.
Obviously, because obviously, if we're scared of something, it wouldn't matter what that is, we're not doing it. If you're scared of water, we don't go and swim. Whatever it is, you know what I mean. So that's great. But wouldn't it be also phenomenal for patients who, well, they're not necessarily all that scared, even though everybody's a little bit anxious of going in the dental chair, and it's at least uncomfortable. And it's, like when I go for a cleaning, which takes about 40 some minutes, well, it's not that it is painful, or a root canal, which I had, I don't know, some 12, 14 years ago. It was not painful at all. But, counting sheeps while you sit there and a guy works on you for an hour, it can get pretty boring for a hyperactive guy like me. You know what I mean? So anyway, isn't it also good for people who think or are obviously busy and they don't want to go for 9 dental visits over 9 weeks to fix something, but say, doc, can you just sit me in at 10 o'clock in the morning, walk me out at 2 o'clock in the afternoon and get my whole mouth fixed? Wouldn't it be good for those type of people also? Because that time to come and go, and is extremely powerful. It's worth a lot to them.
Yes, all kinds of long cases. It is a very nice facility for the patient to have, where they come in, they get all their work done, and they're asleep during that time. So it's for different groups of people, but mainly, as I said, it's for people that are extremely scared. I mean, if you're a normal patient and you want a long appointment, of course, it's extremely uncomfortable to be in a chair for 4 hours. So
Right.
if you are sedated, that time goes by and you don't know anything, and it's very beneficial to those patients also. Yes.
Great. Ask me, what about children, teenagers? Can they have it? Should they have it? We hear about children who are like, not all that
The
cooperative, I guess.
pedodontist, yes, the pedodontist always faces this every day, where he will have a 3-year-old that has 5 teeth that are rotten because of baby bottle syndrome or whatever the mom is doing, giving them sugared water or whatever, and they need a lot of work. These children no way are going to be able to be treated normally. You can't talk to a 3-year-old that I'm going to numb your mouth. The only way you can treat them is sedate them. And therefore, sedation dentistry is an extremely important tool for our pediatric dentist, because that's the only way he can work on these young children. I mean, not all children need it, but the ones that need it, the facilities are there.
Right. Beautiful.
So for children, it's a good facility. For parents, because otherwise they are just struggling to get their kids treated.
Now, are there any other known side effects, rather than the patient probably needs a chauffeur to drive him home, but he would have to do that after a heavy operation anyway? Is there any other side effect?
There are always risks with medications. There are always risks. But having done this for quite a few years now, we make sure that we have ascertained that the patient is healthy enough for us to treat in our environment. And the medications we use are just like Valium. And people have Valium all the time in this country just to go to sleep, to help them sleep sometimes. So the medications are not the kind that can cause a lot of problems. And these are medications that are very, very safe in terms of use in a clinical environment like ours.
Right. And of course, it's only a surgery done at the most every few years or so, the need for it. So there's no becoming addicted really possible, because it's not something like an aspirin you take all the time.
No, it isn't. And like I said, this medication, the IV medication especially, is a very short acting. So let's say if I am doing a 1-hour procedure, by the time I'm finished, the patient is having a conversation, is able to stand up and walk out. I mean,
So
we
it's
put
very
them in a
controlled.
wheel.
You know exactly
Yes.
how long he gets knocked out.
Yes, exactly. And we are titrating the amount we are giving as well. So every 10, 15, 20 minutes, as the patient, we can see that the patient is arousing, we give him a little bit more. So we are never using too much medication or too little medication. But we are always under control, and the patient is really awake by the time they're going out, and in a very, very, very short time.
Right. And if your procedure for some reason takes longer than you as a dentist expected, you just give him a little more to cover that time.
Yes, we titrate it, yes.
Beautiful.
We titrate it, we give them
Beautiful.
more, yes.
So it seems to be, again, it's a wonderful thing because, as you mentioned, the fear of going to a dentist, it probably comes from the old time where the drill was bigger than, than it was big.
Well,
and the needles were big. They were like a water hose almost,
Yes.
It was painful, bloody, and all that type of stuff. The equipment, people probably only went when it was really hurting, so the tooth was usually very infected, which these days is not so much happening anymore. People go a little earlier. So, but not doing it because of fear, for whichever reason that comes, that's near that, is taken away.
It's just harmful to their general health. So
Yeah.
access to treatment for patients like that, knowing that it's available, is very, very important.
Right. And because, this type of treatment, the sedation dentistry, really is not yet complete mainstream. I mean, yeah, a fair amount of some doctors have it, but apparently it's still a smaller percentage of doctors, dentists who do it than doctors who do it. Am I right there or what?
It is. Yes, you're very right. There's not a lot of access to doctors that practice it, and you really need to seek out the ones that do it if you need this type of service. So sedation dentistry is a special license that you have to take. You have to go and take these courses, and you do at least 24 cases. I took my license at USC, and we have to go and treat 24 patients before we are given that license under supervision. So yes, you are right. Access to care like this is only available in certain offices, certain dental offices.
Thank you very much, Dr. Patel.
Thank you.